Hi again, everybody. I'm Rob Rosenthal with AskTheLawyers.com, and welcome to another episode of Ask the Lawyers. For many people, gastric bypass surgery can change their life, but it isn't without dangers. And today we're going to ask about those dangers and how they might lead to medical malpractice. My guest is attorney Michael Warshauer of the Atlanta-based Warshauer Law Group. Michael's an award-winning attorney with a history of verdicts and settlements exceeding tens of millions of dollars and has been rated one of Georgia's super lawyers for 9 years running. His firm focuses its practice on personal injury cases. Michael, thank you for making some time for us today. I appreciate that.
I'm glad to be here.
So let's start at the beginning. In case people don't understand, can you explain for the layman what is gastric bypass surgery? And well, let's just start with that. What is it?
Gastric bypass surgery is a weight loss reduction through surgical procedures. There's several different kinds that are available. And I will be showing a slide in a moment.
Okay.
It talks about the adjustable gastric band. That's really sort of a minimal surgery. The Roux-en-Y gastric bypass, which is a major surgical procedure. The vertical sleeve gastrectomy, which is also somewhat minor, but pretty major. Your stomach's taken out, or part of your stomach. And the biliopancreatic diversion with a duodenal switch. And that's also a major surgery. And anytime you do a major surgery in someone's intestines, there's opportunities for leaks. And when there's opportunities for leaks, there's opportunities for really bad results.
What sort are complications? Are those common? Do you know any sort of percentages of how often there are complications from these surgeries?
Well, with most surgeries in modern medicine, the percentages are fairly low. But when they do occur, particularly with this kind of surgery, if not detected, the consequences can be very serious. So when we are talking about the ones that are diversions of your intestines, where they're taking your stomach out or part of your stomach out, they're taking out a section of your intestines in order to reroute it. Whenever you do that, you've opened a wound in the intestines and you're having to stitch the intestines back together. Anytime you stitch the intestines back together, there's a potential for a leak. And we know that when the intestinal fluids, acids, partially digested food gets into your abdomen, it's really bad. So what we're mostly looking for is leaks. And the creation of a leak, let me make this clear, even the best of surgeons can have a small leak. That's not the issue all the time, although sometimes that is the issue. The issue that we see is the failure to appreciate the leak before the leak becomes life-threatening. And too often we'll see a doctor who has too much self-confidence. There's no way that I made a leak, and therefore they fail to detect it. And that's where the bad results happen.
Is it generally the kind of thing that pretty much right away you know there's something wrong, or can it take a while before they realize how bad things are, and maybe by then it's really gotten bad?
Well, generally you might not, a little of both. Sometimes you will know within hours. They will use a variety of tests to determine whether there's a leak. They use colored fluids. They use a variety of things to see whether there's leaking into the abdomen. Sometimes it'll be several days, sometimes even weeks before the juncture fails, this stenosis or connection of the bowels together fails. And when that occurs, there has to be pretty rapid response or there will be a bad result.
How do insurance companies approach these procedures? Are they considered very high risk? Are they hands-off? How do they approach this?
Well, most people are going to have one of three insurance choices. Private insurance is going to provide for weight loss reduction if you qualify. And I want to talk about the qualifications in a moment, because one of the things that I'll talk about it right now. One of the things that we see that can often end in a bad result is that when people are too big, and then the surgeon is faced with vastly more complex surgery. He's got to get through a whole lot more adipose tissue, or fat, if you will, and it's just harder. So we see surgeons who will go outside what should be a patient within their skill set. So that's an issue. But for people who are within the norm, around 35 to 40 BMI is sort of the sweet spot for this surgery. Many insurance companies will cover that. Medicare will also cover it. Medicaid doesn't do pre-approval. So for those patients, they sort of have to, there's a little risk, and the surgeons or offices will do that. And that brings me to one of the real reasons that we see bad results in this surgery. It's a very profitable surgery for hospitals. It's a very profitable surgery for the doctors who do it. And as a result, we often see, or too often, we see doctors who are inadequately trained, maybe a weekend course on how to do this very complex surgery, set up a weight loss clinic at a hospital. The hospital advertises it. They bring people in, they show them slideshows. Your life's going to be better. But the surgeon who's in charge of this and the staff at the hospital really doesn't have the experience to handle this complex surgery. And that's where we're seeing bad results too, because insurance companies are covering it, and therefore it's very profitable for the hospitals.
And then if there is a bad result, are the insurance companies, as in many cases, unwilling not to pay off, to compensate?
Well, now we're talking a different set of insurance companies.
Right.
So the first group of insurance companies I was talking about are the ones that pay for people to have the surgeries.
Right.
The second group of insurance companies are the ones that insure the hospitals and the clinics, the doctors, and the nurses. And as with all medical malpractice cases, they are very well prepared to fight. They do fight. They defend their doctors. They defend their hospitals. And that's why it's important that someone who believes they're the victim of medical negligence or medical malpractice hires a law firm that has experience not only with that kind of surgery, but generalized experience in handling medical malpractice cases, and that they have the financial resources to go toe-to-toe with giant hospitals, community hospitals, and giant insurance companies, not to mention successful bariatric surgeons who sometimes make mistakes and they just don't want to admit it. So, I can't blame them for that, but they certainly fight these cases.
So how can an attorney, since you mentioned that, such as your firm, how can they, I mean, sometimes just things happen, and then sometimes the doctor made a mistake or it's medical malpractice. How do you tell the difference?
Well, in our office, we tell the difference with a thorough review of the file. We're going to gather the medical records. We're going to have them reviewed. We have the luxury of having our own medical doctor in our office 5 days a week, which very, very few law firms have. And our medical doctor and our attorney staff will look at the case, look at the review, look at the medicals. And if we feel there's something wrong, then we have an expert bariatric surgeon who's unrelated to our law firm give us an independent review. And if we have our own review that we think something went wrong, and we have an independent review that we think something went wrong, then we're going to proceed forward. As you alluded to, not every bad result is a result of bad medicine. People who get this surgery are often very sick. They're morbidly obese. They often have a lot of comorbidities, diabetes, high blood pressure, things of that nature. And so therefore, we have to take that in mind, but the doctor has to take that in mind too, and make sure that if he picks a patient that's a difficult patient, it's within his skill set and it's within the skill set of the hospital that he does it at. It's one thing to do this at a major medical center where if anything goes wrong, anything can be addressed. It's another thing to do this at a community hospital that has set up a weight loss clinic to make money, and when something goes wrong, they're really not prepared to address it. And that, of course, can cause malpractice and cause tragic results for the patient and their family.
You mentioned that it's important to choose a firm that has the resources and have the experience to handle these sort of cases. Is it also important to choose a firm that is prepared to go to trial, prepared to litigate the case?
I think in any medical malpractice case, the law firm that you choose has to have an experience of trying cases. You mentioned insurance companies earlier, the insurers who represent the doctors and the hospitals. They check us out. They know who's tried cases. They look at our verdicts. They look at the appellate reviews that have happened about our law firms. And they go, these people will never settle, or they'll never settle for cheap.
Right.
We better pay them what's fair. Or they'll look at a firm and go, these guys hadn't tried a case in 5 years. Just offer them anything. They'll take it because they're scared of trial. With our firm, our history shows that while no one wins every time, we absolutely will go to battle every time it's required to get what's fair for our clients.
So what would be your takeaway advice for someone if they have had an issue, they've had this surgery, and maybe they think something's wrong, or maybe they're a loved one of someone who had something happen, and that kind of leads to another question. If someone has passed away and their loved ones are going, I think there might have been malpractice here. Is it too late at that point? At what point do they contact an attorney in this situation?
Well, anytime you think something's going wrong, the first thing to do is to get the best medical care you can possibly get. Yell at everybody. Don't be a passive patient.
Right.
Be an advocate. Be an advocate for yourself. Be an advocate for your family. Assuming that you recover from that, and in these gastric bypass cases, when things go bad, the cases that come to us, the people do not recover.
Oh, wow.
Sometimes they recover, but most of these result in a death because you get septic. And if you get septic, that's very, very difficult to overcome. It ends up with major organ failure and a variety of other problems associated with sepsis. So do get care, keep notes throughout the process. Do insist on an autopsy. I hate to be morbid, but it's very difficult for us to prove that you died from a leak if we don't have an autopsy that showed that you died from a leak. Because keep in mind that this particular patient group has a lot of other problems.
Right.
They might weigh 450 pounds, and therefore they have high blood pressure. They could have died from a stroke. They could have died from a heart attack. They could have died from a variety of things. We need to make sure, if we're going to have a successful result, that the cause of death is indeed associated with this particular surgery.
Michael, thank you so much for your time today. I think you've answered a lot of really good questions for people. I appreciate it.
All right, thank you.
That's my guest has been Michael Warshauer, the Atlanta-based Warshauer Law Group, and that's going to do it for this episode of Ask the Lawyers. Please take a second and click on the subscribe button at the bottom of the screen so you can know when we have a new episode of Ask the Lawyers. And if you think you or a loved one has been the victim of medical malpractice, you want the best information, and you're ready to choose a lawyer that lawyers choose, please visit AskTheLawyers.com. I'm Rob Rosenthal with AskTheLawyers.com.